Hi, I'm Dr. O'Gwen, and in this video what I want to do is discuss and demonstrate how our office can help manage and alleviate most of the common types of headaches. If you suffer from headaches, you're not alone, and you probably know that headaches can dramatically interfere with your desired quality of life. Recent studies indicate that migraine headaches can have a greater negative impact on your quality of life than chronic health conditions such as osteoarthritis, hypertension, and even diabetes. It's also been suggested that headaches are the most common reason for the use of over-the-counter analgesic medications. The types of headaches can vary greatly, but chiropractic has been found to be one of the most common alternative therapies for the treatment of headaches such as migraine headaches, tension headaches, and cervicogenic headaches, which we'll talk about in a minute. And this is because chiropractic treatments can safely and effectively relieve muscle tension, restore balance in the spine, and decrease irritation of the spinal cord. And when I say that, let's go ahead and zoom in here and I'll show you what I mean. Looking at this spine model here, this is the neck, this is the back of the head, and if we lift this up here you can actually see an opening into the spinal cord here. And the outer layer of that spinal cord is a very sensitive area. A lot of times these muscles and these tissues that are in the back of the head and the back of the neck have attachments to that outer layer of that spinal cord, and when there's restrictions, when there's any kind of misalignment, any kind of tension in the muscles, it pulls and aggravates that spinal cord. That can cause a referral of pain into the back of the neck, the back of the head, and that's what causes a lot of these different types of headaches. So what we're going to do here is demonstrate some of the techniques that we use in the office to relieve that tension in the back of the neck, and we're going to demonstrate a chiropractic adjustment. Allison here had some chronic headaches for, how long did you have these for, Allison?
Oh, for a really long time.
For a really long time, forever. She's had them forever. And she came in and I'd say we got relief within 2 or 3 treatments. And right now I have my contact on the back of the skull here and some of these muscles. And you can see I stretch, I'm mobilizing that area where I find the restrictions, I find the tension. We've got some nice pressure on here. And this usually feels very good for the patient. We check both sides. We get rid of that tension. Sometimes we're going to go into some of the muscles in here, and we would stretch these and do some muscle release in here. We palpate and we find out where the restrictions are. And nice and relax for me. And that usually feels very good for the patient. How did that feel?
Great.
All right, good. So again, these are some of the techniques that we use in the office to alleviate a lot of the most common types of headaches. Again, these are tension headaches, cervicogenic headaches, and migraines, which we have the most success with.